The approach that we have utilizing, which I call Formnovélle, because it's a more of a therapeutic approach, but it utilizes a technology which is called emerald. It's an emerald laser, and this emerald laser it uses a low level frequency of green light. It doesn't burn you. It doesn't it doesn't use heat. It just uses photons. Now remember that every single cell in our body is producing energy and is producing photons. So we are literally energy beings. We just don't think of ourselves that way. But this particular technology goes right into the area where you have excess weight. It goes right through the skin, and then when it finds a fat cell, in other words, that frequency is specific for fat cells, it basically makes microscopic little pores. Now the fat cells imagine if you punctured a balloon that it's in gore, all of a sudden all the air comes out. Now you have a fat cell that has released its dysfunctional material, and then the fat cell itself will heal those microscopic pores within 5 days. So now you have this shrinkage that release all the dysfunctional material from the fat cell, and now what you created is a healthy fat cell, because the fat cell itself healed those pores, and now it's ready to help you achieve the healthiness. So it's a very effective treatment. The studies have shown that in 8 treatments, an individual can lose 6 inches. Okay,
Wow.
that's without changing diet or exercise. In other words, this was FDA approved. And in order for it to be FDA approved, they did what's called double blind studies. So they use sham technology in a laser versus the real technology in another laser that looked the same. The technology that they use is the red light or just the green light. Okay, so they
Right.
utilize that technology versus the actual low level laser. So the doctors didn't know, the patient didn't know. That's what it means to be double blinded. And
Got
it
it.
was done in multiple centers. And at the end of the day, they realized that individuals who actually had the appropriate technology, they released an average of 6 inches in 8 weeks without having changed their diet or exercise. Now imagine what we can do
Wow.
if you actually begin to change adjustments in your diet and exercise, your lifestyle. Of course, this technology, I don't think it fixes the problem,
No.
but it facilitates a process by which we can release a lot more effectively. Now, if we're going to maintain that
Right.
release of 6 inches, hopefully we're changing our lifestyle.
Right.
Otherwise, it's going to last a couple of months. And then if you're going to go back to eating dysfunctional and eating and drinking and taking dysfunctional medications, then eventually you're going to go back to where you were before. But if you actually take advantage of that technology and change your lifestyle, which is where our focus is in my practice, then the results that we're seeing are 12 inches, 10 inches, 8 inches. So we're
Wow.
seeing significant amounts of good success in individuals that need to release those 8 or 12 inches. Because if somebody just has a little bit of love handles, it'll definitely get rid of them, but that's not going to be a 12-inch release.
Right.
In other words, it just targets the excess fat cells. It doesn't really make you become something that you're not.